Alright, so I'm going to be demonstrating how to put a muzzle on a patient. Clarabelle here doesn't actually need one, so a lot of times it'll be a lot more difficult. But what I like to do is just kind of slip it on so that they can't bite my hands or anything like that. So when applying the muzzle, this little skinny part always goes on the top of the nose, the long fat part goes underneath. A lot of times it's easiest when they're being aggressive if you come in from behind and you just quickly slide it on their nose like so. Clip it in behind their ears and then tighten the muzzle. It's also important to make sure that you get a muzzle that fits their face properly so that it's not too tight and making it so they can't breathe, and it's not too big to where they can still bite you. Now, if a patient is being really aggressive, I will make a brown gauze muzzle. Sometimes you have to do this because getting your hands close to their mouth can be really dangerous. So what I'll do is just make a little knot like this. I'll lower it down over their muzzle, and then, come here, Clara. Lower it down over their muzzle, and then just tie it shut like so. And then you can come back behind their ears and tie it like that. And it also makes it a lot easier for you to slip the muzzle on safely. So that's that. I'm going to demonstrate how to use a rabies pole. Now, generally we use this on dogs that are very aggressive and want to lunge at you. Obviously, Clarabelle is not one of those patients. But they'll be running away or trying to lunge at you. And then you want to get this around their head. And the way you tighten it is by pulling on this. And this way, when you're pushing them away, you can also be pulling it tighter. And then from there, you can slip a leash on them. Somebody can come up and give them a medication that might sedate them, IM, things like that. And that's how you use a rabies pole. Alright, I'm going to be showing an alternative way of restraining a cat. So this is going to be the kitty burrito, or using a towel to restrain. This cat obviously doesn't need it, but we're going to demonstrate with her. So we lay the towel out flat. Usually this might involve two people because you have to be scruffing a bad cat. But you're going to bring the back up so that they can't scoot out of it. And then we're going to take one corner up under the neck, and we're going to take the other corner up under the neck and just make it a nice tight burrito. And then from here we can manipulate the cat and it can't scratch us, and then we can also pull blood from the jugular vein if we need it. So I'm going to catheterize this sedated dog for urine. I have sterile gloves on, I have a sterile syringe, a French catheter, I used a size 5, and then sterile lube on the tip of it. So I'm going to have Shelby protrude the penis, and we are going to insert our French catheter and just guide it in all the way. And we'll pull back and see if we're in the bladder. And there we are. And then when we use this sample, we always void the first that we get, because that can have bacteria from the urethra. And then we collect a more sterile sample. And that's how it's done. Okay. Alright, are we recording? I'm going to do a free catch urine sample and express the bladder on this anesthetized dog right now. So first I have Novosan solution, and I'm going to go ahead and just wipe up and make sure that there's no external bacteria. I have a clean bowl here, and then we will go ahead and express the bladder. We want to avoid the first catch that we get because this is going to have all the bacteria from the urethra in it. And then we have our free catch urine in our bowl. We're going to take a sterile syringe and use this to suck it up. There's going to be bacteria in it. There's no way around that just because it's free catch, but all of these things we're doing just to minimize all the bacteria that we can. There you go. I'm going to be collecting urine with cystocentesis. So I have my ultrasound. We're going to put alcohol on the abdomen right over the bladder. And then locate the bladder using the ultrasound and with my sterile 2-inch 20-gauge needle. We're going to go in at an angle, and you never want to redirect after you've poked. You can lacerate the bladder and other organs. And then we're going to collect our sample, pull straight out, and that's it. Alrighty, we're going to be expressing the anal glands in this little chihuahua here. So I have my gloves, I have my sterile lube, my paper towels, and then I like to use Novasand solution to clean them up afterwards. So we're going to feel for the anal gland sacs at 10 o'clock and 2 o'clock. I know, honey, it's okay. And then you're just going to kind of milk them to express them. Hang on, little thing, I know. Alright, and then we're going to wipe them up, and then clean them up with our Novasand, and then we're all done. The recording? Alright, so we're going to be trimming toenails today on the dog. This is my dog Clara. She does have black toenails. So when we're trimming the toenails, for black ones at least, what I always like to do is trim them back a little bit at a time so that I don't hit the quick. And then when you start seeing the little soft tissue in the middle of the nail, that's when you know you've gone far enough. Normally I would have somebody else holding, but because this is my dog and she's really good, I don't need to have anybody holding on to her. Okay, so we're going to trim the nails of the cat, and the cat's nails are a lot easier because you can't see the quick on them. So we're going to protrude the nail by pushing on the pad, and then I like to go right where the hook is, right where the pink is, and then we're just going to cut them right there. And don't forget the dew claw. Right. I'm going to be demonstrating how to hand pill a dog without using a pill pocket or other treats. So my favorite thing to use is a pill gun. I don't usually stick my hand down a dog's throat because a lot of times they'll spit it back up and I don't want to get bit. So we'll use a pill gun. We have our pill here. We're just going to stick it into the top of it. I like to grab their jowls right behind their canines, and that'll usually make them have to open their mouth up. And then we'll take this, stick it into the back of the throat and push the button. Make sure that they swallow, which she just did. You want to check their cheeks because that's where a lot of times the pill will end up. And then open their mouth one more time and just make sure it's not back there, which it's not. So that is how you pill a dog. I'm going to be hand pilling a cat with a pill shooter. So I'm going to grab behind the jaw and then open it up just like that. And we're going to take it and stick it down to the back of the throat. Make sure she swallows. And then we'll open the mouth back up, make sure that there's nothing in the cheeks. And that's how you hand pill a cat. Alright, so we're going to clean out Clarabelle's ears today. Normally I'd have somebody holding, but she's really good, so I'm just going to do this by myself. We're going to take our Trizultra, which is our ear flush, and dump it into the ear canal. Then I like to use cotton. Put a piece of cotton down there. And then just massage the base so you can break up all the earwax. And then we're going to take the cotton out. She'll shake her head. Just really get all of that flush out of the ear. Make sure that it's mostly out. And I already did the other side too. So just make sure that this is nice and dry. Her ears aren't too dirty right now. Then we're going to take our Momentum-Max or our Maxiotic or whatever ear ointment that we're using. This has a little bit of an antibiotic in it. Has an easy applicator tip. We're going to put this inside, down into the ear, applying a couple drops in there, and then just massaging the base. Make sure that gets all over, and she'll probably shake her head. There we go. Cat's ears, and we just burritoed her, so it's going to be really easy. She's hiding her face. She's camera shy. So we're going to take our ear flush. I dump it into the ear. We're not going to like this at all. Then we'll take a little bit of cotton, put it inside of the ear, and then just massage the base a little bit to really break up the wax. And then we're going to use the cotton to clean up the rest of the solution that's in the ear. And then medicating the ear, we're going to take our Maxiotic or Momenta-Max, which is the same that we would use in dogs, and we're going to stick the inserting tube down in the ear, and then put a couple drops in there, massage the base a little bit, and then you repeat on the other side. Okay, so this is going to be a demonstration of a topical medication. So Clarabelle here, she gets some rashes on her stomach right now. She doesn't actually have one, but I'm going to show what we would do if she did have one. She's not very long haired, so we don't have to clip her, but normally you'd clip all the hair away. I'm going to take some Novasand solution and just kind of clean up the area, getting any like yeast or anything that might be on there. Stay there. And then we're going to dry that up. No, lay down. Lay down. Lay down. Good girl. We're going to dry that. And then we're going to take our Genta spray and spray a good amount right where the rash would be. And just let that sit. Alright. I'm going to pass a gastric tube. So the first thing we're going to do, pick our tube, and then we're going to measure down to the last rib, which is going to be right to about where the black line already is. Normally you'd mark it, but there is already a black line made on this because we use it so often for this very reason. We're going to put lots of lube at the end of this so that it really passes smoothly and doesn't cause any irritation. And then we take an Elasticon and put it in the mouth just so that we can hold it open. It makes it a lot easier. And then I'm going to have Rachel here hold the mouth shut. Now when I pass this, there's a couple things that we're going to be looking for. You'll be able to see the tube coming all the way down. And then we're also going to test it with water. So we're going to pass this. And then she should swallow it. And I'm watching it go down the right side, which is appropriate. And then we're just going to advance it until we get to our line. Now we should get some negative pressure back. Which it looks like we're getting. So we're going to push it through, and then as long as we don't cough, which I'm not hearing any coughing, we are safe to do any kind of barium or charcoal or anything like that that we want to. Now we're going to take this out and then remove our mouth gag, and that is how you place a gastric tube. Okay, I am going to be demonstrating a full eye work, which is going to include a Schirmer tear test. It's going to include staining the eye for any kind of ulcers or scratches on the lens. And then we're going to be doing tonometry, checking the pressures. So for the Schirmer tear test, we do want to keep some level of sterility to it. So I do have gloves on, which makes it really hard to open this package. I might be opening it from the wrong end. Alright. And then, without touching the tip or trying not to, we're going to bend it at the blue line. And then we're just going to insert this in the eye, right by the tear duct, right here in the corner of the eye. And then we're going to hold the eye shut. You want to keep this in here for 1 minute. For the sake of the video, I'm not going to keep it in for the entire time. After the minute is up, you would take it out, and wherever the blue goes after a minute is what the tear production of the eye is. An average dog's tear production would be 15 on a Schirmer tear test over a minute. So that's how you would do a Schirmer tear test, and then repeat on the other side to get an accurate reading on both. The next thing you would do is stain the eye. So I've already made some fluorescent stain here. Put it in a syringe because it makes it a lot easier for administration. So we're going to take 1 drop, put it in the eye, and then we're going to take some saline, and all of this is sterile, and we're going to rinse it out. Just like that. And then at that point you can look at the eye underneath a black light, and then any kind of scratch on the surface of the eye would fluoresce very much, and you would be able to tell if there was any kind of ulceration on the eye. Now for tonometry, I have proparacaine, so we're going to want to numb the eye with some proparacaine. So we're going to put just a couple drops, and I'm only going to demonstrate on one eye today. And let that sit in for a minute, not a full minute, it doesn't take that long to make the eye numb, but just for a little while so that it can get absorbed. The tono pen is always stored with a cover on the tip of it to keep it calibrated, but the tip is always needs to be assumed to be not sterile. So we're going to remove the old one, we're going to take a new cover. Put it on the tip here, and then from here we're going to push the button. It's going to beep at us, and then we're just going to kind of tap on the center of the eye until it beeps again and it gives us a reading. Alright, so once we get a reading, this one says 20 and the accuracy is 90. So the reading that you get, that's the pressure, and then 90 is the accuracy of the tono pen. So it will tell you 95%, 90%, 80%, sometimes less than that. And that's going to help determine whether or not the readings you get are accurate. You want to repeat that same thing 3 times in each eye just to make sure that we have an actual average reading on each eye. We're going to store the tono pen with the cover on it. And then that's how you do a full eye workup. Okay, I'm going to be making an enema for our cat Spunky here. We're going to be using a pet enema, some lube, and then some warm water to make it. So I'm going to take the pet enema, put it in here, use just a splash of lube because it makes things a little bit easier coming out. And then we're going to put just a little bit of water in here. Make sure that's mixed up nice and well. And then this is in a syringe with a red rubber top that I previously cut to fit the syringe properly. So we're going to get the tip with some lube so it goes in nice and easy. Make sure that all the air is out of this. We don't want air in the butt. Alright. Now when we insert this, we're going to want to put this red rubber tube as far up as it goes. Okay, so that feels pretty good. And then what I do is I'll squeeze it, pull out, push, pull out, push a little more, just so that you get it all through the intestine. It makes it all nice and slippery. And then we're going to pull it out and run the cat through his litter box, and hopefully we have a bowel movement. Okay, I'm going to demonstrate giving subcutaneous fluids to my dog Clarabelle here. We're going to use lactated ringers. Very rarely will you ever use anything other than that for sub-Q fluids. So I have a new needle on my bag of fluids. The bigger gauge needle you use, the quicker the fluids are going to go. So I'm going to take my sterile needle, and then in the subcutaneous tissue here, I'm just going to make a tent. I'm going to insert the needle into the subcutaneous tissue, open the bag of fluids, and from here I'm going to squeeze. And then you're going to put however many mils of fluids the doctor wants you to do, 500, 750, sometimes they want to do a full liter. Clarabelle doesn't actually need fluids right now, so I'm just going to demonstrate. So once you're done giving the fluids, we're going to clamp off the line, pinch where the needle is so that the fluids don't come back out, remove the needle, and then we're going to place the cap back on. And then we're going to pinch or hold off where the needle came out just so that all the fluids don't come rushing back out. And then you're all done. Okay, we're going to be doing a modified Robert Jones bandage. So this one pretty much is just a lot of padding, and the reason we're going to do that is to just really secure whatever joint it is that's broken or sprained or we're trying to keep immobile. So we're going to go distal to proximal. We do want to make sure that we're leaving some toe open. I already put the stirrups on, and I used the tongue depressor to make it easier to pull the tape apart and flip it up and put it on the leg. So distal to proximal, we're going to just apply a lot of layers of the gauze padding. It's going to look like a baseball glove, or a boxing glove, I should say. And then especially, we're going to really put a lot of emphasis on the area that we're trying to keep immobile. So we're going to use a couple rolls of this. Just make sure that we make it really, really thick so that nothing is moving around underneath it. We don't want to make it too terribly tight either, because we don't want any kind of swelling, but we do want it taut so that it is keeping, like I said, everything immobile. Alright, so we have a nice big old boxing glove. Now we're going to take our cling and we're going to apply one layer of this, distal to proximal. And the reason we do this is because it does reduce swelling, because of how it makes the blood flow. So distal to proximal, I'm going to take my scissors and just cut this like so. Now we take our stirrups, and we're going to deflect these back so that we can see just a little bit of toe, not too much though, because it will put bad pressure on the foot, and that can cause pain, which we do not want to cause. So we're going to put our stirrups on, and at this point we are ready for our last layer of either vet wrap or Elasticon. At our hospital we always use Elasticon. Keeping the toes exposed, we're going to go distal to proximal, making sure to overlap, and again not applying it too tight but firmly enough. Okay, I'm going to remove this modified Robert Jones wrap that I just so beautifully placed right now. So I'm going to put my finger in here and just kind of pull the Elasticon away from the skin and make sure that we don't cut anything. And then when you get to the cotton, I like to just cut that top layer first, just so that I don't have to worry about cutting the skin, because the Elasticon, or if it was vet wrap, these are both the hardest layers to get through. So from there, we're just going to start cutting all of this padding off. Trying very carefully not to cut any of the skin. And then we'll pull our stirrups off. And there you go. Alright, I'm going to be placing a back leg splint on Clarabelle today. So I've already put my stirrups on. I have a tongue depressor in between just to make it easier for them to come apart when I deflect them back. First layer is going to be our cotton layer. The way we want to wrap this is distal to proximal with every layer that we have, and we do want to make sure that the toes, just the tip of the toes, are exposed. Too much toe exposure is going to cause pressure that is going to hurt. So we're going to start by wrapping the foot, and like I said, distal to proximal. And when you wrap the foot with a splint, you always want to make sure that the bone that is broken, which hypothetically, let's just say that the bone is one of the toes or one of the digits on the foot, you always want to wrap the two joints that go above it so that the leg is completely immobile. So we are going to put our cotton layer on all the way up past the knee. Making sure to overlap every time we go around. Next is going to be our cling layer. Once again, we're going to make sure that the toes are exposed. And then we're just going to do this all throughout the cotton layer, making sure to overlap each time we go around. Alright, so that's on there. Now we're going to take our back leg splint, which is going to be the perfect size for Clarabelle's leg. We're just going to make sure that it's placed properly on here. Now this is the step where we take the stirrups. We're going to twist them and deflect them back so that the toes are nice and exposed. And a lot of times, especially with a front leg splint, this will also help secure the splint on there, especially since we don't usually sedate patients when we put splints on them. It makes it a lot easier if they try and pull it away to keep the splint where it belongs. Now for a normal splint, I would normally put more cotton on here, but since this is coming off immediately, I'm not going to put more cotton, but you do want to make sure that there's a lot of padding so that the splint doesn't dig into the skin and cause any kind of sores. So we're going to take our elasticon, which is going to be our final step. And again, making sure that some toes are exposed, distal to proximal. We are going to go ahead and just wrap the leg with our top layer. Some clinics use vet wrap for everything. I personally don't like to use vet wrap for any kind of wraps that are going to stay on for extended periods of times because it does like to shrink up, and I've seen too many cases come back in because of swelling. So we're going to wrap all the way up, making sure to overlap every time. Also, before I did this, I stretched out all of this elasticon, because if you don't stretch it out, then it will become too tight. And then I do like to make it just so that it's touching a little bit of hair at the tops, just to keep it from sliding down. So this is our splint. We have our toes exposed so that we can monitor for any kind of swelling going on. Now I'm going to show you how to properly take it off. Always use bandage scissors. These are the safest way to take any kind of bandage off. We're going to come back from the back, and we're just going to, I like to put my fingers in there just to make sure that we're not cutting any kind of skin and giving the pet any kind of laceration. And we're just going to cut down the side of the splint. And I'm kind of cutting now just above the bottom layer of cotton just to make sure that we're not getting any skin in there that we could lacerate inappropriately. Now we're going to take the tape off, and there you have a splint put on and then taken back off. I'm going to be doing an emergency wrap around the abdomen of my dog. She just got some sedation, so she's a little bit stoned right now. So the main thing with an abdomen wrap, there's going to be a lot of things that vary just depending on what the doctor wants the wrap for. So this is going to be as if the doctor wants to put a wrap on now just to keep the stomach from distending, assuming that we got some kind of laceration that's bleeding. So the main thing that we're kind of focusing on is just wrapping the abdomen, not so that we can't breathe, but more so that it can't distend full of fluid. So we're going to start with a thin layer of cling. And we're going to wrap this around the abdomen. And you do want to do it somewhat tightly, not to the point, like I said, where it's going to make their breathing uncomfortable, just to the point where it's going to hold the stomach pretty tight so that the bleeding can't cause the stomach to be super distended. Now, because we are going to be doing a short-term emergency wrap, I'm going to use vet wrap. If we were to be putting it on for long-term, I would use Elasticon because that's going to stick to the fur and it's going to stick a lot better. But we're doing this as if we're reassessing the wound in, say, 2 hours after placing the wrap. So again, we're going to make this a little bit tight, but not too tight, because we also have to keep in mind that vet wrap does shrink back up after it's been placed on. And this would be an emergency wrap for an abdomen if it was bleeding. I'm going to be going through the steps of an emergency triage. So the very first step usually is when the client communicates with you, more than likely over the phone. So you're going to kind of get an idea of what's happening, the history, at least kind of get prepared for when they come down. When they first come in, you're going to take a look at the dog. So the things that you're kind of looking for to make sure that we're breathing well, our heart's still beating properly, we're not super neurologic, not having weird mentation. So one of the ways you can kind of check to make sure that our oxygen and our blood flow and everything is really regulating well is checking the color and the capillary refill time of the gums. So as you can see, Clarabelle's gums are pretty pink. They're a little bit paler than they would normally be right now because she is on Dexdomitor. But they're very pink. If you push on them, the capillary refill time is very fast, which is pretty average. Now, what you'd be looking for in an animal that wasn't regulating oxygen properly because it's not breathing or because its blood is not flowing well, they'd be very pale, sometimes even purple. The capillary refill time would most of the time not even be there, or it would be very delayed. Other things that you can kind of look at are their eyes, kind of give you an idea of hydration level. If they're sunken in, that can usually mean that they're pretty dehydrated, which can be an emergency if it gets to a certain point. Now, after the patient has come in and you've assessed what's going on and the level of critical care that it needs, assuming we need to rush it into the back because it does need to be it is an emergency status and needs to be taken care of. Quickly, we're going to, very first thing, make sure that we have an airway. So a lot of times if a patient is crashing, we're going to place an endotracheal tube. And this way we can really control the breathing, and we can breathe for the patient if for whatever reason they're not breathing on their own. The next step is going to be gaining vein access. So we are going to place a catheter and get on a shock rate of fluids, and that's going to increase the volume of the blood inside of the body, and then it's also going to give us access to the vein in case we need to push any kind of epinephrine or atropine or anything that's going to help the patient breathe easier, things like that. After you have placed a catheter, and this should all be happening really fast, sometimes all at the same time, we're going to want to make sure that our heart is beating. So if for whatever reason we do crash to the point where our heart is not beating, we are going to start CPR on the patient, doing 2 minutes of chest compressions, and then you have to switch off because it can be very tiring for the person doing it, and then giving a breath. I believe it's every 10 seconds. You do want to assess for any external injuries, so if there's any profuse bleeding coming from anywhere, we do want to make sure that we are stopping that after we kind of get to the patient to the point where it's stable enough to assess situations like that. And then if we can somehow get the patient back after crashing, we do want to check mentation. A lot of times when patients crash, they will become brain dead, or they will just never become themselves because their brain dies from not having enough oxygen or blood flow sent to it. And that would be the basic triage of an emergency. Okay, I'm going to be simulating a laceration. So we're going to have to use our imagination here and pretend like there is a laceration right here on the leg. So if this was an open laceration and I really wanted to try not to get any kind of or minimize as much hair getting into the wound as possible, we're going to use some sterile lube, and we're going to just place a fair amount inside of the incision, or I should say laceration. And this is going to really keep the hair that we're about to shave from getting into the laceration. So after placing the lube inside of the laceration, we're going to take our clippers and we're going to clip a very wide margin around the laceration so that the doctor can place sutures, or we can just keep it really clean and keep the hair from irritating the laceration any more than it's already going to be irritated. So we're going to shave it up, make sure that it's really good. Once it's completely shaven, we're going to irrigate the laceration with betadine or Novosan or whatever other kind of antiseptic that the doctor prefers. We usually use betadine here at the hospital. So with a curved tip syringe, we're going to go in there and we're just going to really pressure wash it and just make sure we get all of the hair that we can out of the laceration, because that's going to really help with the healing. And a lot of times if anything gets left in there, it will cause infection, and then they have to come back for abscesses, or they have to get more antibiotics, things like that. So let's just assume this laceration was sutured back up. So now we have sutures here. A lot of times if it's on the leg, the doctor is going to want to wrap it because that's going to be the best way to keep the pet or the patient from getting to it. So we're going to do that. Most of the time the doctor is going to want to apply some kind of medication on it. Mupirocin is a big one that we use here at this hospital. So if we were to be applying medication onto this, we always use a Telfa because that's going to keep it from sticking onto the gauze and making it super unpleasant. So we're going to put some mupirocin spray or mupirocin on our Telfa. Then we're going to put our Telfa on the leg, right where the sutures would be. We're going to apply just a small bandage, putting our gauze padding on first. And we should be wrapping distal to proximal, always. Then we're going to put our cling padding. Can you grab that? And then we're going to apply our Elasticon or our vet wrap. And this is going to be a fully taken care of laceration. Alright, so I'm going to be demonstrating dental today. I already cleaned half this dog's teeth, and I'm only, for the sake of time, going to show the canine, but I will be cleaning the entire mouth and polishing and doing all of that. So with our manual Profi, we have our dental probe, and this is really good for after you scale and polish. You can kind of get into these cracks. You can break off the tartar pretty easy with these guys. I prefer to use my dental ultrasonic scaler. I have it set to 30, which is going to be the pressure of the water coming out of it. And then you always want to make sure not to hold this on the tooth too long. I believe it's 15 seconds that it gets to be on the tooth, and you're constantly wanting to move it. So we're just going to move it around, break off that tartar here. Just get it all off of these teeth. Make sure we get under the gum line. And then that's nice and pretty. Now in a tongue repressor, I've already gotten Profi polish. I'm going to take that with this guy. Just put some in there. And then you want to polish the tooth for 10 seconds. So we're going to do that. So from there, we're just going to go ahead and rinse this tooth. And there you have a nice clean tooth, and the rest of the mouth is going to look just like that. Okay, I'm going to be talking about some home dental care. So first thing, brushing teeth. If you want to start brushing your pet's teeth, we do recommend using an enzymic toothpaste that is made for dogs. You never want to use a human toothpaste on a dog because the fluoride is very dangerous for them and they can't spit it out like a human could. So you want to use some kind of toothpaste that is formulated for dogs. It doesn't have any fluoride in it. A lot of times they will be fun flavors. So flavors for cats also exist too. There's flavors for ferrets, things like that. So as far as brushing the teeth goes, we do recommend, if you can, doing it once a day. That would be the most ideal. Obviously, people are people and dogs are dogs, and they don't really sit still for things like that. So doing it a couple times a week, if you can, is going to really greatly minimize the amount of tartar and calculi that builds up on the teeth. Diet. There are certain diets that you can buy that are dental diets that have enzymes that break down calculi and tartar. Royal Canine makes a dental diet. I believe that you can buy dental diets at feed stores, things like that. Those are recommended especially for the smaller dogs who tend to get dental disease a lot more frequently and a lot worse than the older dogs do. Dental diets can be very good. There are other things that you can purchase to add to water that have enzymes in them. Rawhides or oral chews that have enzymes in them can break down tartar as well. And nothing can beat old-fashioned chewing on bones and sticks to break down tartar. One thing that you can buy is Dentahex. This is an oral rinse that you just put into the mouth, and again, it just breaks down tartar and it also makes their mouth fresh and clean. And there's lots of over-the-counter things that you can get to, like I said, apply to the water. You can just use it in their mouth, in their food, things like that.